Walking is one of the most beneficial activities for overall health after 70 and should remain a foundation of your fitness routine. However, walking alone doesn't provide all the movement variety your body needs for optimal function. This video covers 5 types of movement that complement walking to support strength, balance, flexibility, posture, and joint health, all essential for maintaining independence and mobility as we age. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting new exercises. Understanding movement variety after 70. Walking provides excellent cardiovascular benefits, supports bone density, improves mood, and maintains basic mobility. These benefits are well documented and valuable at any age. However, walking is primarily forward motion that engages certain muscle groups while underutilizing others. After age 70, maintaining comprehensive fitness requires variety, strength training for muscle maintenance, balance exercises for fall prevention, flexibility work for joint health, core training for postural support, and low-impact alternatives when joints need relief. This isn't about replacing walking, it's about complementing it with targeted movements that walking doesn't fully provide. Let's explore each type. Movement Type 1, Strength training for muscle maintenance. After age 50, adults naturally lose muscle mass through a process called sarcopenia. Without resistance training, this loss accelerates, potentially reducing strength by 30 to 50% between ages 50 and 80. Walking maintains cardiovascular fitness but provides limited resistance to leg muscles and minimal engagement of upper body, core, and posterior chain muscles. Strength training addresses this by providing the resistance stimulus muscles need to maintain and even build tissue at any age. You don't need a gym or heavy weights. Effective strength training for older adults can use body weight, resistance bands, light dumbbells, or household items like soup cans or water bottles. Here are 3 accessible strength exercises: wall push UPS for upper body, stand facing a wall, arms length away. Place palms on wall at shoulder height. Slowly bend elbows, bringing chest toward wall. Push back to start. This strengthens chest, shoulders, and triceps, muscles used for pushing tasks like opening doors or rising from bed using your arms. Perform 8 to 12 repetitions, 2 to 3 sets, 2 to 3 times per week. Chair squats for lower body, stand in front of a sturdy chair. Lower yourself until you lightly touch the seat, then stand back up. This strengthens quadriceps, glutes, and hamstrings, the muscles that enable standing from seated positions, climbing stairs, and maintaining balance. Perform 8 to 12 repetitions, 2 to 3 sets, 3 to 4 times per week. Bicep curls with light weights, hold a light dumbbell or water bottle in each hand, arms at sides. Bend elbows to lift weights toward shoulders, then lower with control. This maintains arm strength for carrying groceries, lifting objects, and daily tasks. Perform 10 to 15 repetitions, 2 sets, 2 to 3 times per week. Start conservatively and progress gradually over weeks. The goal is sustainable strength maintenance, not rapid gains. What to realistically expect? With consistent practice over 8 to 12 weeks, you may notice everyday lifting tasks feel easier, better control when standing from chairs, improved confidence in physical capabilities, and gradual increase in what you can lift or carry. What you should not expect: dramatic muscle growth like younger athletes, quick transformation in weeks, or complete reversal of decades of muscle loss. Realistic, gradual improvement is the goal. Movement Type 2, Balance training for fall prevention. Falls are the leading cause of injury among adults over 65 in the United States. According to the Centers for Disease Control and Prevention, 1 in 4 older adults falls each year. Walking is excellent exercise but doesn't specifically challenge the balance systems your body uses to prevent falls: your proprioception, body position awareness, vestibular system, inner ear balance, visual input, and ankle/foot stabilizers. Balance training specifically targets these systems. Here are 3 effective balance exercises: single leg stance, stand next to a counter or sturdy chair for safety support. Lift one foot slightly off the floor. Hold for 10 to 30 seconds. Switch legs. This challenges weight shifting and ankle stability. Practice daily, gradually increasing hold time as balance improves. Heel toe walk. Walk in a straight line, placing one foot directly in front of the other so heel touches toe. Use a counter or wall for light support if needed. This challenges dynamic balance during movement. Practice 10 to 20 steps, 2 to 3 times, several times per week. Standing with eyes closed, stand next to support. Close your eyes for 5 to 15 seconds. This removes visual input, forcing your body to rely on proprioception and vestibular systems. Practice with nearby support, gradually increasing duration. Important safety note: always practice balance exercises near stable support. Never push beyond what feels safe. If you have significant balance impairment, work with a physical therapist first. Realistic expectations: with consistent practice over 4 to 8 weeks, you may notice improved confidence during walking, better stability on uneven surfaces, quicker reactions to balance disturbances, and reduced fear of falling. Balance training won't eliminate all fall risk. Many factors contribute to falls, but it's one important component of fall prevention. Movement Type 3, Flexibility and mobility for joint health. Walking moves joints through a limited range of motion, primarily hip and knee flexion/extension in a forward plane. It doesn't require spinal rotation, shoulder mobility, hip external rotation, or many other movement patterns. Over time, joints not moved through their full range can become stiff, limiting daily function like turning to look behind you while driving, reaching overhead in cabinets, bending to tie shoes, or twisting to reach something beside you. Flexibility and mobility work addresses this. Here are effective stretches and mobility exercises. Seated spinal twist. Sit tall in a chair. Gently rotate your torso to look over your right shoulder, using the chair back for light support. Hold 15 to 30 seconds. Repeat on the left. This maintains spinal rotation needed for looking behind you and reaching across your body. Practice daily or several times per week. Shoulder circles and reaches. Slowly circle shoulders backward 10 times. Then reach both arms overhead as high as comfortable. This maintains shoulder mobility for overhead reaching and dressing. Practice daily. Ankle circles. While seated, lift one foot and rotate ankle slowly in circles, 10 circles each direction, both ankles. This maintains ankle mobility important for balance and walking. Practice daily. Neck turns and tilts. Slowly turn head to look left, then right. Gently tilt ear toward shoulder on each side. This maintains neck mobility for driving and daily activities. Practice daily. These gentle mobility exercises can be done during TV time, while waiting for coffee, or before bed. They don't require sweat or strain, just consistent attention. Realistic expectations: with daily practice over 3 to 6 weeks, you may notice reduced stiffness upon waking, easier movement during daily activities, improved range when reaching or turning, and reduced discomfort from prolonged sitting. Flexibility work won't reverse arthritis or eliminate all stiffness, but it helps maintain available range of motion. Movement Type 4, Core and posture training. Walking engages core muscles minimally for basic stability but doesn't strongly activate the deep core muscles that support spinal alignment and posture. After 70, core weakness can contribute to forward-leaning posture, kyphosis, lower back pain, reduced breathing capacity, and balance problems. Core training addresses this. Here are accessible core exercises. Wall posture hold. Stand with back against a wall. Attempt to touch the wall with the back of your head, shoulders, and tailbone simultaneously. Hold for 30 seconds to 2 minutes. This teaches proper alignment and engages postural muscles. Practice daily. Seated pelvic tilts. Sit tall. Gently tilt pelvis forward, arching lower back slightly, then backward, rounding lower back slightly. This mobilizes the lower spine and engages core muscles. Perform 10 to 15 repetitions, once or twice daily. Abdominal bracing. Stand or sit tall. Gently pull belly button toward spine as if bracing for a light touch to your stomach. Hold for 5 to 10 seconds while breathing normally. This engages deep core stabilizers. Practice several times throughout the day. These exercises require no equipment and can be done during commercial breaks or while waiting for something. Realistic expectations: with consistent practice over 6 to 10 weeks, you may notice improved postural awareness, reduced lower back discomfort in some cases, easier breathing, and better stability during movement. Core training won't eliminate all back pain or create dramatic posture changes quickly, but it supports gradual improvement. Movement Type 5. Low-impact alternatives for joint health. Walking is low-impact compared to running, but it still involves repetitive stress on knees, hips, and ankles. For some older adults, especially those with arthritis or joint pain, walking long distances can cause discomfort or inflammation. Low-impact alternatives provide cardiovascular and strength benefits with less joint stress. Effective options include water aerobics or aquatic exercise. Water buoyancy reduces joint loading by 80 to 90% while providing resistance for muscle work. This is excellent for those with significant arthritis or joint pain. Recumbent cycling. A recumbent bike supports your back and reduces knee stress while providing cardiovascular benefits comparable to walking. Chair-based exercises, seated marching, arm raises, and resistance band work provide strength and cardiovascular benefits without standing impact. Tai Chi. This gentle martial art improves balance, flexibility, and strength through slow, controlled movements. Research shows Tai Chi can reduce fall risk in older adults. Seated yoga or stretching provides flexibility and mobility benefits without standing balance challenges or floor work. These aren't lesser exercises, they're appropriate alternatives when joints need relief from impact. If walking leaves you consistently sore, swollen, or in pain, that's your body indicating it needs variety or modification, not just more walking. Realistic expectations: low-impact alternatives can provide similar cardiovascular and strength benefits to walking while reducing joint stress. You may notice less post-exercise soreness, reduced joint swelling or stiffness, ability to exercise longer or more frequently, and improved overall function. Creating a balanced routine. Here's how to incorporate all 5 movement types alongside walking. Walking. Continue regular walking as your cardiovascular foundation. Aim for most days of the week as comfortable. Strength training. 2 to 3 sessions per week, 10 to 20 minutes, targeting major muscle groups. Balance training. Daily practice, 5 to 10 minutes, can be integrated into daily routines. Flexibility/mobility. Daily practice, 5 to 10 minutes, can be done during TV or downtime. Core/posture, daily awareness and short exercises, 5 minutes. Low-impact alternatives, use as needed when joints are sore or as walking substitutes 1 to 2 days per week. Total additional time beyond walking, 20 to 30 minutes most days, often integrated into existing routines. Important context and limitations. These 5 movement types complement walking to create comprehensive fitness. However, they exist within broader health context. They don't replace medical care for chronic conditions. They may not be appropriate for everyone without modifications. Individual assessment matters. They're most effective when combined with adequate nutrition, sleep, stress management, and social connection. And they work best as part of long-term lifestyle, not short-term fixes. You should consult a healthcare provider or physical therapist before beginning if you have significant pain-limiting movement, recent surgery or injury, complex medical conditions, severe balance problems, or if you're unsure about appropriateness. Realistic timeline for improvement. Movement variety yields gradual improvements. Weeks 1-4, learning exercises. Building initial neuromuscular connections, possibly mild soreness, normal. Weeks 4-8, exercises feel more natural, some functional improvements may be noticeable, ability to progress difficulty slightly. Months 3-6, clearer improvements in strength, balance, flexibility, and function, increased confidence in physical capabilities, sustainable routine established. Ongoing, maintenance of gains with continued practice, continued gradual improvements possible, reaching appropriate plateau is normal and healthy. The goal isn't endless progression, it's achieving and maintaining functional capacity that supports your desired activities. Conclusion: walking is excellent and should remain part of your routine. The evidence supporting walking's benefits is strong and clear. However, walking alone doesn't provide all the movement variety your body needs after 70 for optimal strength, balance, flexibility, posture, and joint health. By adding these 5 movement types: strength training, balance work, flexibility exercises, core training, and low-impact alternatives, you create a comprehensive approach that supports long-term mobility and independence. This isn't about doing less walking. It's about doing more types of movement to complement the walking you already do. Start small. Choose 1 or 2 areas that feel most relevant to your needs. Practice consistently. Progress gradually. And remember, movement variety at any age supports the body's remarkable ability to adapt and improve. Thank you for watching. If you have specific concerns about your mobility, strength, or balance, consult with a physical therapist or healthcare provider for personalized guidance. Subscribe for evidence-based information on movement and healthy aging, practical guidance grounded in research, not hype. The goal isn't perfection. It's sustainable movement variety that keeps you strong, steady, and independent.